grew up being an athlete, playing multiple sports. Football was something I went on to excel in, like Aaron here, and went on to play collegiate football at the University of North Texas down in Denton. I too, lots of ankle sprains. A lot of times I felt like it was from the brace that we wear. College offensive linemen are used to wearing a brace that's supposed to be a preventative brace that we're not supposed to blow out knees and things like that. And quite honestly, I think it did do its job. There were no knee blowouts and things like that, but it does cause an ankle sprain. That pressure is going to go somewhere down my legs. But after ball,
so I'm a big fan of knee sleeves and a belt. Knee sleeves, personally I felt, and a lot of my clients I treat are Olympic weightlifting athletes, power lifters. They just feel like the compression, the heating of those joints, if it's elbows, knees, they feel better, and I'm all for it. If you feel good, you're going to perform well and everything. Same with a belt. I like to use it just to establish that brace with a client and everything, so they can feel like, okay, I've activated that core, or that filling into that canister, your imaginary little canister, to help stabilize the lumbar spine, and that belt just gives you that reassurance. You have that feedback from, okay, I'm filling into the belt and everything. So
it's not a gym accessory; it's an actual,
used correctly.
When used correctly, yeah. Some people, I try not to step on toes, but I laugh when I see people wearing belts and they're doing bicep curls.
I think first and foremost, past your fundamental levels of fitness, it's appropriate to understand that these are accessories and just that, and not everyone needs everything in the book, and accessories don't make you a better lifter, and they sure as heck don't get you in better shape. So appropriate for what fitness level you're at and the intensity level. There are other things out there that I think are beneficial as well. I'm a big on the knee sleeves. I wear them myself. I totally agree with what Doc's got to say about it. I think wrist straps are important as well, depending on where you're at in your programming, just that loading of that joint, of that wrist joint. I think there's other items as well, the hip circles and warm-up devices and things like that to working on as you lift in those big lifts, things like that. Used appropriately, I think those things are all necessary and appropriate for your fitness regimen. Getting carried away with having things that you have no clue how to use, or things you don't wear, or not appropriate for fitness level wise, that's kind of silly and a waste
like
of
wearing
money.
lifters and doing bicep curls.
That's right, absolutely.
Yeah.
And you must understand that having these things doesn't mean that they allow you to be capable of doing them. You are capable of doing these things without these aids, these items. These enhance your workout, and that's what they need to be treated as. Not, oh, I have to have my belt on to do this, or I have to have my lifters on to squat this, or I have to have my wrist straps on. They're just accessories to help with a little bit of injury prevention and things like that, leaving you more ready and able to come back to working out consistently.
And it's tough because of our society and culture. No one wants to walk around, oh, let me stick my belly out while I breathe or fill, because everyone's like, oh, I gotta look thin, so we sit here and suck in, which compromises our breathing pattern, and we breathe through our chest, which can lead to upper trap activation. We're always tight up here, SCM, scalings. So it's just a lot of it's a product of our culture. We all want to appear and look thin, and unfortunately, we don't breathe like we should. If you look at a newborn as they sit there and breathe, you see the abdomen expand and everything. Versus, you take a 22-year-old college girl, she's going to sit here and suck in and everything.
It's interesting to think about how we train ourselves out of something that we were born to naturally do correctly.
Yes.
Which you guys end up fixing all the time anyways,
That's right? That's right.
I would have to say probably it's going to be personal preference,
right?
Both brand, both need, right? And how much that need is need, and how much that is want. I think personally for me, I like a nice thick, it makes me feel good, makes me feel secure. It allows me to recover movement in my knees during squats or hinge movements, clean movements and things like that. But again, I think it's complete preference, and you're going to find what works for you, and I think that you need to run with those things. I don't think you get caught up with, well, this person's got sleeves that cost them this much, and they're a little thicker, and my sleeves are a little thinner, and well, they lift a little more weight than me.
Right.
It's not the sleeves.
And
you know what I'm saying?
and the sleeve itself is actually pretty.
People tend to forget about is the intensity of my workout and how do I measure that. And a lot of us Americans, including the ones that know what they're doing or think they know what they're doing, work out just kind of at the seat of their pants. Here at Lifetime, we've incorporated a lot of heart rate zone training, so the workout's a little more personalized. So as we get into devices, talk about using your heart rate tracking devices, compared, your Morpheus app, both, and then your Garmin watches and things like that. I think it's also important to monitor your level of intensity. That way you're working out a little smarter. That is, again, our philosophy here at Lifetime. But I think those devices are important. And once again, just like any of your other lifting devices, just because I have the devices doesn't mean I'm going to get in shape, or doesn't mean that I'm doing things correctly per se. So again, those things would be, need and level of fitness and things like that. But those would be some other devices that come to mind, along with some other higher end or deeper in recovery devices, say maybe Theraguns or Hypervolts. I know that we use both that and some Normatec boots. I'm a big fan of those as well, both hip attachments, and I think those have proven to be.
You're also, with the compression factor in those Normatec boots, you're decreasing the blood lactate, basically your lactic acid and everything. So allowing you to recover quicker so you can get back to training and you're not like, oh gosh, I'm so sore, I can't even squat. So
does it essentially flush the system?
Yeah, I would say so. I would say so. Yeah.
The NAIA national tournament, where we had some of our higher level athletes that are in some pretty grueling matches, and I had the chance to take those there, and some of our athletes were very appreciative of how they felt in between matches, and both even in that 3-day time frame, which we're talking about athletes that are at the end of a 30 match and 40 match season that are really just trying to get through that national tournament, and survive, move on one match at a time. So we definitely had some success, feedback as far as working with athletes, between myself and my wife and a lot of the other trainers here. What's going to allow you to train longer and more effectively, and of course prevent any kind of fatigue or any kind of absence from your training program and or the gym. So that's essentially why we would use that. But it's also important to understand that heart rate training needs to come from an assessment, right? So if I don't know what your personal zones are and lining up 3 30-year-olds and telling you all to get in the same heart rate zone, heart rate number zone, that means absolutely nothing, right? That's not going to be, pinpointed, personalized, type of working out. So it's important to understand that we're doing these things from a personalized assessment, a metabolic assessment, versus just strapping a heart rate monitor on you and saying, okay, let's go, everybody get up to 155 for the hour.
It's by your age and your weight based off of some table.
Sure. Yeah, we're not gimmick here.